All right. Good afternoon, morning, or evening, everyone. Thank you for joining us back again on Self-Directed Medical Care, the next episode of Your Education. Remember, our mission is to free Americans from the addiction to health insurance and the sick care system by providing them medical financial education to help them self-direct their medical care, save money, see any doctor they want, get the highest quality, lowest cost care in the country, and teach them how they can do this all while potentially also saving for retirement. Today, I have a very special guest on the episode with you, or with us, I should say, and that is Shawn Needham. He's a pharmacist, and he and his wife, Janet, who is also a pharmacist, own Moses Lake Professional Pharmacy out in Washington State. It's a specialized compounding pharmacy creating customized solutions to the health problems that drug companies cannot always solve. And their unique business plan allows them to offer better pricing and service to their individual client. Shawn is also currently a clinical assistant professor at the University of Washington School of Pharmacy, where he teaches the advanced compounding course. And he's also an Amazon best-selling book author. His book, Sickened: How the Government Ruined Healthcare and How to Fix It. Check that out on Amazon. We'll talk about that a little bit here in the episode. Shawn and Janet also host an ever-growing podcast called Health Solutions, with Shawn and Janet Needham, where Team Needham basically discusses everything surrounding healthcare. So without further ado, Shawn, could you please tell us just a little bit about yourself and your background in the context of how you got to be doing what you're doing today?
Well, thank you first of all for having me on this podcast. I really appreciate it. And, Janet and I are really inspired to educate and empower patients to take care of their own health. And that includes financial. So that's what we'll be talking about today. And that's kind of where the journey started with me. I graduated from French school in 1994, and I realized right away, and I had already met Janet, and we realized right away that there was just a lot of issues in healthcare that we didn't, agree with. So that's one of the reasons that we opened our pharmacy in 1998. And we were a full service pharmacy. We did everything from sell wheelchairs to, dispense regular medications, and we billed insurance. And in 1999, we realized it was the first time we turned an insurance away. And here's one of the reasons why. We did a quick audit on a prescription I did, and we were getting paid 50 cents over our drug cost because this was before Medicare Part D. And so drug companies had to be a lot more competitive on their pricing because there was no prescription drug benefit for seniors yet. So drug prices were actually lower. So $50 was a pretty common price for a drug instead of $500. That might be a topic for a whole nother section about why that pricing went so high after Medicare started paying for medication. So when people say, oh, I can't wait for the government to pay for something so it'll be free, you want to see things get expensive, wait till it's free.